Okay, so me and Kayla got Dorothea Orem. Dorothea Orem was born on July 15th, 1914, in Baltimore, Maryland, where she was the youngest of two daughters. She attended Seton High School in Baltimore and graduated from there in 1931. After graduating high school, she attended Providence Hospital School of Nursing in Washington, D.C., and graduated from there in 1934. She then went on to earn her BS in nursing education in 1939 and an MS in nursing education in 1945 from the Catholic University of America. And then these are the two pictures of where she went. The hospitals that she worked in included Providence Hospital, Washington, D.C., and St. John's Hospital, Lowell, Massachusetts. Specialties included surgery. She was a private nurse both in the hospital and at home, pediatrics and adult medical services, and then she was a night supervisor in the emergency department. The work and education she did was Orem taught in the CAIRS of Biological Sciences and Nursing from 1939 to 1941. She was in charge of the Direction School of Nursing at Providence Hospital in Detroit, Michigan for 10 years, served as an assistant and adjunct professor at the Catholic University of America, served as the Dean of Nursing from 1965 to 1966 at Providence Hospital School of Nursing. And then she also served as an advisor and consult to institutions such as Indiana State Board of Health, U.S. Office of Education, and the Department of Health, Education, and Welfare. Lastly, she worked at Johns Hopkins Hospital in the Nursing Development and Experiment Center and in the Wilmer Clinic Nursing Directorate. So Orem's theory is Dorothea Orem self-care deficient nursing theory. The role of a nurse is to fill in the gaps of care that an individual cannot provide for themselves. Individuals will initiate and perform their own self-care activities on a regular basis so that their overall health and well-being can be maximized. It is only when an individual can no longer provide for themselves that they will seek out professional care from a provider like a nurse. Orem believes this is more of a reactive than proactive action. Only when an individual cannot care continuously for themselves is it appropriate for a nurse to provide assistance. So there's 5 different methods of help. These methods are in order to restore an individual's ability to care for themselves. The first one is by acting on a health issue immediately while providing care for others. The second one is guiding others in the actions necessary to provide care. The third one is supporting other nurses and supporting patients in providing and maintaining care needs. The fourth one is continuously providing an environment that promotes personal development. And the fifth one is teaching one another to enhance skill building at all levels of the nursing spectrum. So the background of development for the theory is the theory developed was a result of Orem working toward her goal of improving the quality of nursing in hospitals throughout her state. At the time, nursing was a field that strongly depended on medicine, and the physicians delegated tasks and orders to the nurses. The theory was developed from 1959 to 2001, and the National Library of Medicine said that Dorothea Orem believed that people have a natural ability for self-care, and nursing should focus on affecting that ability. So the research to create this theory, Orem was motivated by the current state of affairs. At this point in history, the United States had already survived 2 wars, and the world of nursing needed major improvements. The nurses did not know how to communicate to their patients or families. The main studies she used were from Nightingale, Abdullah, Roy, and Orlando. Odom's comprehensive approach included physiological systems and epistemological underpinnings to clarify the nature of reality and the environment where patients and nurses communicate and cooperate. Odom's research is also seen in the psychiatric profession. This theory goes hand in hand with this profession because it promotes the overall health and independence of the individual. These professionals also step in when self-caring for the specific individual is compromised. By receiving psychiatric care, this individual will be more receptive to self-care. Application of the self-care theory to nursing practice. This theory raised the idea that we as nurses should treat the patient holistically rather than just physically. Therefore, we provide better care to the whole person, body, mind, spirit, culture, socioeconomic background, and environment. What we find troubling about this theory is that people must be determined, willing, and constant in order to achieve self-care. We are not able to constantly be with the patient to aid in that process when they are at home. Nurses are only able to step in when taking care for themselves is compromised. Also, people experience hardships and might not be as open to providing care for themselves, but this theory covers a broad scope with general concepts that can be applied to all instances in nursing and encourage patients to be active participants in their care. Today, this theory is used as the basis of what is taught in nursing school. Nurses must be able to critically think while applying their care holistically. And then these are our reference pages.